Hello, everyone. Welcome to the Breakout. I hope you're having a good day so far with the event that's going on. I am amazingly proud to be hosting this breakout room with three incredible folks. Rachel, hello. How are you this afternoon? Jonathan, 7 p.m. Thank you. 7 p.m. in Jerusalem, right? Have you had your dinner yet, or are you ready for it?
After this.
After this, okay. And Prentice, you're in California, right? Breakfast or coffee?
Pleasure to be here, Ritesh.
Thank you.
Yeah, I'm here in California. It's a great day, actually.
Oh, don't tell me. We've got 30 degrees here in New Jersey at the moment, so I'm very jealous of you at the moment. I think both of you. So let's get started. Well, in the interest of time and to maximize this conversation, everybody, I'm going to do the introductions if folks on the panel don't mind. And I'll start off with Rachel Hodgston. Rachel is the president and CEO of the International Building Institute, where she's leading a movement to advance human health through better buildings, vibrant communities, and stronger, more equitable organizations. I love her motto. It's always be winning for good. And she's really put that to work at IWBI, developing research-backed tools to help organizations create places where people can thrive. Today, these people-first places extend across 3.5 billion square feet of space in about 109 countries. Prior to joining IWBI, Rachel spent nearly a decade at the intersection of sustainability and human health. She was helping the US Green Building Council make LEED the world's most widely used green building rating system. I was a part of that in my previous life at Cushman & Wakefield, so thank you, Rachel. At USGBC, she founded the Center for Green Scores, which mobilized about $265 billion of investments in LEED-certified educational facilities, deployed over 750,000 volunteers to transform schools on most every continent. Rachel serves on numerous boards, advisories for organizations ranging from the Paul Hawkins Project Regeneration, Out Leadership, and the Walgreens CSR Advisory Council. She's a graduate of Tufts University, sought after media voice, inspirational speaker, and the recent winner of the People Leader of the Year Award, which was focused on mental health and education at the 2022 Inside Out Awards. Thanks for joining us, Rachel. I hope I did that justice. I'm sure there's more to it.
You sure did. You can't see me blushing through the screen, but thank you.
Excellent. Well, over to you, Professor Jonathan Huppert. You're at, you are the Helen and Sam Baber Chair for Clinical Psychology and the professor in the Department of Psychology at the Hebrew University of Jerusalem. Having never been to Israel, I hope I did that justice. Okay, good. He's the former department chair and former head of the clinical program. He is the head of the laboratory for the treatment and study of mental health and well-being at the Hebrew University, and has been working for over 25 years, treating, studying, and working to improve treatments for anxiety, OCD, and related disorders. He's a published individual. 150 articles and chapters on processes and outcomes in cognitive behavioral therapy, CBT as I call it, experimental psychopathology, assessment, emotion regulation, the alliance placebo effects, and more recently, imagery-based interventions and theories of treatment. Professor Huppert has worked on dissemination of cognitive behavioral therapy throughout Israel. He's been spearheading the development of the internet-based CBT in Hebrew, and also improving access to evidence-based treatments in collaboration with Israel's Ministry of Health and HMOs in Israel. Thank you for joining us, Professor Huppert.
Yeah, thanks for having me here.
And finally, Dr. Prentice Tom. He's a physician by training. He's currently a senior partner at Vituity, which is one of the US's largest clinician services companies, seeing approximately 8 million patients per year, including 1 million telemedicine visits a year. He's also served as the Chief Medical Officer, Chief Innovation Officer, and Executive VP for that organization. In addition, Dr. Tom is the Chief Medical Officer at Kitsugi, which has been voted by Inc. magazine one of the 5 most innovative companies in healthcare today. They've created an AI-supported tool that can screen for depression and anxiety with a voice-based solution in about 20 seconds of any conversation. Dr. Tom is a Harvard Medical School graduate. He completed his residency at Johns Hopkins, is a Kaiser Fellow at MIT, and is served on the faculty of Stanford Medical School. He's active in health technology. I can tell you, he's a bit of an innovator. He's an advisor to the Health Tech Capital. That's one of the nation's preeminent early stage funding sources for health tech startups, and has served as an advisor to many digital health companies. Now, this is the scary bit. He's also a big cyclist. He did the death ride multiple times. We're going to have to figure that one out. He's also a big skier. He skied on 3 continents. And most of all, the oldest person to receive the black belt in Krav Maga. I had to go look that up. From the Show Me Cats, previous head of hand-to-hand combat training for the Israeli Special Forces. I remember sending Dr. Tom a note saying, remind me not to upset you. So with that, amazing colleagues, thank you for joining me. This is going to be a great session all around health and wellness. You've each got individual passions around this. So Rachel, maybe we could start with you and your current role. Some of the standards and practices you're bringing to health and wellness that you did with LEAD. What are some of the big things you're tackling at the moment?
I think that we approach the span of opportunities that we have for addressing health and well-being from the same perspective as is directed by the social determinants of health. So that's something that you may have heard of before. It's essentially a universal truth held by the public health community and backed by research. And what the social determinants of health have to say to us is that where you sit and who you sit next to, or your physical and social environments, have a greater bearing on your state of health than your access to healthcare, your genetics, and your lifestyle and behaviors combined. And so the way that we've internalized that at IWBI is that the greatest opportunities that we have to make change to truly impact the outcomes in people's lives as it pertains to their health, their well-being, their productivity, is to focus on the intersection of those physical and social environments. We do this primarily through the Well Building Standard, which is the world's leading certification for healthy buildings and organizations. Well can be applied to a single location, an entire building, or an entire organization or real estate portfolio. And what we do at IWBI, I call it our art, is to translate evidence, the evidence of what actually drives change in human health and well-being to practice by creating an actionable road and flexible roadmap for buildings and organizations to advance their goals. So we're looking at that which the building can do through design and operations and facilities management, and then that which the organization can do through programs, through policies, through amenities and benefits. And at the intersection of those, I think we really find a sweet spot, as our thousands of customers can attest, including about 20% of, a little more than 20% of Fortune 500s that are utilizing Well as exactly that, a roadmap for advancing health, well-being, and performance-related outcomes.
So it's that combination of the environment you're in plus the things you can do. That's your sort of sweet spot by the sound of things, right? That's the frameworks you're creating?
Yes, and where we have the biggest opportunity, I think, to drive change, at least where the social determinants of health weigh in. So we're, could be focused on anything from gender equity through having lactation rooms, but also support for moms and other parents transitioning back to the workplace, to continuous monitoring for air quality, water quality, acoustics, and lighting. So we're looking at the entire range of physical and social factors that can drive impact, and then codifying that within a rating system that, as in my introduction, you mentioned my history with LEAD. So I would say LEAD is to planetary health, like Well is to human health.
Amazing. So, Jonathan, I think this sort of dovetails very well with some of the public policy and public health stuff that you've been pioneering at the Hebrew University. Are you looking at the similar things? I know your background, you've done a lot of work with CBT and behavior and mental health. Is that a focus for you, or is there a broader reach here?
So for sure, I think a lot of the work that we're doing nowadays is trying to really focus on what can we change, what are the different aspects of behavior and emotion and thoughts that are more malleable and more changeable, and how can we also do more personalized medicine. So figuring out what each person needs in order to change, working on identifying people's strengths and helping them change, and figuring out where their targets are to help them do that. And then a lot of what we've started to do is we've developed internet-based cognitive behavioral therapy programs for CBT, where first we checked them in our lab, and now we're working on disseminating them throughout the public health system, the public mental health system in particular to start, but I actually think it needs to go beyond that to the whole health system in many ways as well. And so working on training therapists throughout the country to be doing low resource, high effective evidence-based practice through internet-based treatments, and constantly trying to incorporate new technologies as they come along, whether it be to do more adaptive modules that can be eventually adjusted by AI and other things, but that's kind of down the road, I think, before it's ready for use in terms of interventions. But that's definitely some of the direction that we're trying to go in as well.
So it's that combination of humans and training them on how to do these things, as well as new innovative technologies that you can provide to the population base, basically, right?
Exactly.
Amazing. So that dovetails really well with Prentice and your background in innovations and what you're doing with respect to innovative technologies. You seem to have been doing this for a while, and this new one seems to be voice. Can you tell us a bit about that?
Yeah, thank you, Ritesh. First of all, it's just a real pleasure to be here. And before I start, I just want to thank Rachel and Jonathan for their comments. You know, I have to agree with Rachel. There's the social determinants of health. It's coming to the forefront of medicine and healthcare, and it's just so incredibly important. And the role that the social determinants play in our overall health and well-being are just phenomenal. And then to Jonathan, the work that's being done in the coordination between the Israeli government and the academics and industry has been phenomenal. It's actually put Israel at the forefront of biotech and digital tech in a lot of ways in this country, in this world. For myself, I've actually had the opportunity to be involved in a variety of different companies. I'm still with Vituity. Vituity is one of the nation's largest clinician services solutions companies, and because of their presence, they've had the opportunity to partner with a number of AI and tech companies, including Decoded Health, creating the first front-end chatbot, which will actually create scalability and decrease the cost of care significantly. I'm also working with a company called Sprinter Health, which is actually creating the structure and systems for us to provide mobile blood analysis, which will significantly broaden the depth of care in place. And currently I'm working with Kintsugi. Kintsugi was just voted one of Inc. magazine's 5 most innovative companies in healthcare. They have created really, truly innovative technology in 20 seconds of any conversation. It could have been the first 20 seconds of this conversation right here. They can screen for depression and anxiety with the same accuracy as clinician-administered PHQ-9 and GAD-7 surveys, which are the tools that are currently used for the initial screening of depression and anxiety. They've created a quantifiable, reproducible, scalable, completely non-invasive mechanism for assessing mental wellness. It'll actually create a significant paradigm shift in how we view mental health and mental wellness, and actually provide the opportunity for a much larger percentage of the population to seek various stratified levels of treatment.
So, Prentice, on that note, you know, we are seeing these new innovations, but, you know, to Jonathan's point earlier, is there a model where the rollout of these are still contingent upon, you know, that partnership you have to have with physicians or nurses or whatever? It's not really at the stage where me as a patient can start doing this and then all of a sudden feel well, right?
Absolutely. What we're seeing actually globally, and certainly in the United States, is much more integration of services and end-to-end service solutions. Everything from United Health Group and their clinician and their own clinician group to groups like CVS and Aetna partnering. And so when we integrate care, what we're able to do is fit into the clinical workflows a lot easier, and to coordinate the incentives between the payer, the clinician, and the patient. And I think this overall global change in how we're viewing how healthcare needs to be delivered will significantly accelerate the adoption of various technologies, not just Kintsugi, but all types of health technologies.
Mental health was huge last year. I saw more funding going into mental health, and you see it already on the consumer side, Talkspace, Calm, all of these guys coming through on the TVs here in the US at least. Jonathan, how is there a way to sort what works and what's sort of just something that will end up like a Fitbit in my junk drawer?
So I think there are a number of different aspects of what you're asking. So first of all, I think we should have been prepared ahead of time, that we knew that mental health was going to be at the forefront of the consequences of the pandemic. And in fact, we know that quarantine, long-term quarantine, it raises people's anxiety and depression, and even post-trauma and other things due to the traumas that occur during such types of situations. And I think the whole world found themselves a little underprepared, unfortunately. How we then translate this into something that will become useful, I think there is a lot of importance of basically UX, of what is the user's experience. And there really needs to be a combination of making sure that also there's an evidence base behind what's going on, because there's a lot of products out there that don't have an evidence base, and then there are others that do, and they may have similar user experiences and therefore may still get similar maintenance of use, even though some may be more effective than others. So that's actually it's an important caveat as well in terms of the using of such things. And obviously another issue right now with the pandemic and quarantine and people going back and forth into quarantine is how much people want to engage in screen time to address such mental health issues versus face-to-face time with someone that they would prefer to really have some human contact. So
that leads to the environment. I mean, I'm sure you've seen this, but there are a couple of companies that I've met recently who are also looking at this from can we create something for the actual people at the cliff face, the healthcare professionals who are experiencing huge burnout and mental issues, right? The nurses, the ambulance drivers, people like that. Are you doing something similar at the Hebrew University?
So we haven't worked yet with professionals. I do have colleagues throughout the world who have started to work with physicians and nurses and EMTs to try to help create some kind of psychological vaccination and helping them improve their resilience in these types of situations, for sure.
It sort of leads to the question, so audience members, I forgot to do something very big in my housekeeping, which was to let you know you can ask questions in the Q&A and we'll get to them as we get to them. So there is a question that's been put up, and I'll take pieces of it because there are about 9 different things in that one big paragraph there, Rachel. But environment, going back to the office versus these hybrid models we have, how does that impact what you're doing, right? If I'm only supposed to be in the office 2 days a week and 3 days a week I can stay home, does that impact the certification or framework process, or do I have to change it? Because my home life may be different, right?
Yeah. So, I mean, I'll tell you one really interesting story of something that happened at the peak of the pandemic. We began to realize really early, in fact, way earlier than any of us in the United States or in Israel, for instance, would have been talking about COVID-19. We knew the virus was coming, and we knew that buildings had an important role to play. Why? Because we have about 25 employees in China who are on lockdown weeks and weeks before we were. And that gave us a running start. We got to start looking at an overlay of everything that we knew and were coming to know about the virus and all the guidance that was included in WELL. And we stood up a task force, and we had hundreds of people ranging from the former head of the CDC in China to the former US Surgeon General, Dr. Richard Carmona, to one of the leaders in the healthy building movement, Joe Allen from the Harvard School of Public Health, all came together as co-chairs of this coalition, of this task force on COVID-19 and other respiratory diseases. And what we asked them to help us with was conducting a scan of what was in WELL to say, in light of everything we're learning, what needs to change. Well, it turns out that WELL, as a vehicle of evidence-based practice held up very well. We already encouraged ventilation, filtration, separately ventilated bathrooms, emergency preparedness policies, paid sick leave, and so forth and so on. Where we ended up making the most changes was actually in accommodating for remote working and hybrid working scenarios. So how do we make sure that if we write a feature, for instance, that incentivizes professional development and training around mental health, do we ensure that every employee is being reached and not just those in a physical office environment? How can we incorporate telehealth into our feature language to make sure that that's one of the ways that employers are being incentivized to care for their people? All of that is to say that that the new hybrid reality is as much part of our reality as it is our customers. And so we've started to build more and more pathways into Well to ensure that it can meet our customers, who are essentially employers, where they are. I think in many ways, the home has started to become more and more the purview of the employer, at least in terms of shoring up people's health and well-being. Are we providing our remote employees with ergonomic setups so that they're not suffering from musculoskeletal injuries, which are very much on the rise in light of the pandemic? Are we making sure that we are taking an equitable approach to work from home scenarios? You know, some of us had great environments. You can see all my plants over here in good daylight. We're based headquartered in New York. We had other employees who lived with 2 or 3 roommates, you know, in a 2-bedroom, or had 4 kids, you know, and a partner in a 1-bedroom. The pandemic did not hit us equitably in that way. So how do we make sure that we're providing a certain baseline of physical environment, whether it's in the home or whether it's in the office, for every single one of our employees to perform to their best? So Well can be meaningfully applied to those hybrid workforces. And in fact, IWBI became a majority remote workforce in perpetuity during the pandemic. So we have a lot of empathy for what our customers are doing, and both the challenge of re-envisioning how our office spaces can be better in service to those that are commuting into the office, whether it's 2 or 5 days a week, as well as the entire remote workforce that increasingly many of us employ as a part of our staff.
So, Jonathan, I think that's something similar to what you guys are doing and rolling out across, but not from an employer perspective. It's the population, right? Are you taking into account some of these remote capabilities that you
For
have
sure.
there? Yeah.
So, you know, part of what we've done is develop online treatments so that people can be engaging in them. And we find actually that people do, this isn't online as in what we're doing now by Zoom. It's more like an online course that's asynchronous, that people can actually read texts and watch videos and do asynchronous chat within a secure platform with their therapist. And people engage in this anywhere from 1 o'clock in the morning to 5 o'clock in the morning to their lunch breaks or other times. So one of the aspects of online treatments this way is that it allows much greater access and flexibility in terms of just being able to do it when it suits any given individual. So for sure, that allows for much greater access and utilization.
I think the biggest thing seems to be here in the US, for example, Rachel, you hear the terms, your zip code determines the kind of healthcare you're going to get. You know, if you're
your zip code determines your state of health, not the quality of your healthcare.
That's
even more important.
Okay.
Yeah. So that statement goes something like your zip code matters more than your genetic code, and that's a reference to the social determinants of health.
So, Prentice, in your work that you're doing in both of the companies you're advising, are you looking at those as part of this, on applying tools, technologies, platforms to bring equity or inclusion into healthcare with technology?
Absolutely. I think that technology will play a major role in all this. And actually, as I was saying earlier, I think what it will help do is actually create a paradigm shift that will be valuable to how we view all these types of mental conditions, depression and anxiety. And we move from one where it's mental disease to one of mental wellness. And we recognize that everybody has to look at their own mental wellness, and everyone suffers from some depression and some anxieties to some degree, possibly a lot less than others, some a lot more. But we don't look at it as a disease as much as a part of our well-being. And then we create processes so that we can deal with this, because it's not a physician-centric diagnosis. It becomes a population-centric, patient-centric condition that we pay attention to. And then we look at different, as Jonathan was mentioning, it's not just about clinicians, it's about therapists, it's about family, it's about creating meditation apps and physical exertion and exercise and all types of different interventions that allow us to achieve better mental wellness, actually. And these technologies help us because they allow us to gauge our own degree of mental wellness, just as we do our blood pressure, where every person in the US gets their blood pressure taken, whether they have disease or not. And then they can look at that as a metric of their own wellness.
So, things like a CGM for your mental health, right? So you're seeing these new consumer grade CGMs where athletes are taking, checking their sugar based on intake of food, right? Before they go play a game or something. Those kinds of things are in play at the moment. There was one other question from Jeff earlier, Rachel, that I want to go back to, which is, from Laszlo, around a statement that you made with regard to some research, the impact from a social perspective. Are there, just like Jonathan was talking about evidence-based stuff, are there evidence-based things that you have around all of this?
Yeah, absolutely. In fact, we have thousands and thousands of citations that we've made publicly available through our well building standard, which is free to access at wellcertified.com. We also have on our site and linked to each of our different features, which are like, think of them as the units by which you earn credit toward a certification or a score. We have research digests for each of those features that summarize all of the evidence in layman's terms. Those can be downloaded separately or in a summed together PDF. So if you're interested in tracing back some of the evidence for any of the topics that really we're gonna, I think, talk about today, you can find them there. What I will say about the social determinants of health is, put into Google and you'll find an amazing array of resources. In particular, the U.S. Center for Disease Control has published quite a bit on the social determinants of health. All of the leading public health organizations, and one of the best places that you can go is Robert Wood Johnson's site, Robert Wood Johnson Foundation, who coined the term culture of health, has done amazing leading work on the social determinants of health and structured a lot of collaborative efforts across industries around them. So yeah, you can find a treasure trove of information that really backs that up. But I appreciate Laszlo's comment, because oftentimes when I'm in front of a live audience, I'll say the social determinants of health, like I'll cite it just like I just did. And then I'll say, for those of you who haven't heard that again, you probably want me to repeat it. Because the first time that you hear it, you're like, what? Like we spend all of this time and energy thinking about all of these other factors of health and well-being. We spend very little time talking about physical and social environments. I just got off the phone with Sanjay Gupta, who's going to speak at our upcoming conference from CNN. He's a neurosurgeon, and he, I read his book, World War C, reflecting on the first stages of the pandemic, and there was virtually no mention of indoor environments, for instance. So I don't think outside of certain communities it gets a whole lot of focus or lip service, but what the research absolutely tells us is that physical and social environments play an outsized role in our health and well-being. And when you think about vaccine hesitancy, for instance, when you think about what prompted somebody to make the choice as to whether they were going to be vaccinated or not, it didn't have to do with your access to healthcare, at least not in the United States. I don't think in Israel either. It had to do with your social environment. It had to do with the people you were around. What was your family doing? What was your spiritual community doing? What were your neighbors doing? That was what ultimately drove that. You think about the same thing around nourishment. What drives the food choices that we make? Mostly the people around us,
Well,
and so forth. You could go right on down the list. Yeah, exactly. So I think it's something of a revelation if you've never heard it before, but it's extremely well documented and validated and embraced by the public health community.
So in fact, there are differences, for example, in rates of post-traumatic stress throughout the world according to different cultures, and a lot of that is not due to biological differences, but to social differences. And also we know diet changes, right? The Middle Eastern diet tends to be one of the better ones, for example. and more people in Israel are on the Middle Eastern diet than people in America. And in fact, life expectancy is higher here. And that's part of the reason, right? And so it's an interaction of what you choose to eat, and how you choose to eat it is related to your environment in that way.
So that leads to the other question that I think Usha posted. No, Beth from Beth has posted for you, is around that burnout conversation I started to talk about earlier, and looking at other projects that people are doing. I know I'm familiar with the one in Australia that Beth is citing. I know the NHS in the UK are also rolling this out in Leicester to start with, but then they're heading to Liverpool and Manchester and Newcastle, particularly around healthcare professionals. Is this something that you guys are thinking about? It goes back to the environment, I guess, right?
Absolutely. Burnout across all healthcare professionals has become such a hot topic. The nurse burnout rate, the physician burnout rate. I was at a talk a little while ago where hospital executives were saying that the major stumbling block to innovation right now is burnout amongst clinicians. And what it does, it inhibits people's willingness to try new things, to develop new projects. It's something that's very deep, and we need to look at how we create the tools to support our clinicians, how we create the processes that allow them to recognize their own burnout. And we need to look at everything from work schedule to support for family life to the future of education and how that's impacting clinicians. I think all these are incredibly important, and it has to be a societal level approach. And that's the only way we can actually impact all these social determinants of health. There has to be a significant groundswell of interest and effort to relieve the types of issues that are facing not just healthcare professionals, but all of society. I see one of the questions had to do with public policymakers and their burnout rate. I take the last Oscars that was on 2 days ago as an example of possibly increased stress. You know, I think it's impacting everyone at every level, and we need to look at all types of social changes that we can put in place to deal with it.
So, you know, here in the US, the FDA has also taken a lot of effort into starting to create rules and regulations around some of these apps, as we're calling them, or digital therapeutics. Are the regulators doing the same thing in Israel? Are we looking at ways where you can then point to an approved product as one of your evidence-based solutions, Professor Hubbard?
So I'm not aware of there being it depends on what type of technology. At least certain technologies always require approval before being disseminated, and others you can always have clones and similar types of technologies that are already useful that then can be just replicated and used without necessarily needing formal approval in the same way.
What about the CBT stuff and some of the mental health apps that are coming out?
Right. So at the moment, what we've been developing is really based on evidence-based practice, and it's the main product that exists here. There are a few others that there are some others that people are trying to do that are not quite the same model, and they are trying to base them on evidence-based principles as well. But yeah, there will be a need. I know that also in England there is already an authority that
Germany's doing the same thing as well. Yeah.
But I do think what's important is if we're trying to create interventions, for example, for people to prevent burnout, we need to take into account how busy these people are, and how, you know, one of the problems that happens in these types of situations is that they're too burnt out to even engage in the program in the first place, or they have to give up on some work or some other positive lifestyle issue in order to spend the time doing the burnout prevention program, and that makes it get a lot less uptake. I can say we actually started to develop a COVID stress program right at the beginning of the outbreak, and what the feedback we got was, oh, this is great that you're developing it, but we're worrying about how are we going to lose our job or not, and we need to be focused on, like, how are we going to deal with our kids right now, and not self-care in terms of depression, stress, and other things in that way. So I think timing and how we actually build these things in a way that are easily incorporable and don't have a time cost that actually outweighs the benefits of the program is actually a tricky issue for us to be considering when we're doing these things.
Prentice, in your work that you're doing with these new technologies, what is the sort of the end goal there? Is it to use voice as a marker, for example, or as a predictor of then doing some bigger intervention with mental health?
So, Ritesh, these technologies don't stand on their own. It's not that we're going to come out with a technology that's going to be the be all and end all of screening for mental health conditions. There's going to be a variety of other tests, everything from the longitudinal studies that are done on sleep to neurohormonal studies to facial expression software. And what we'll do is we'll create a constellation of tools that allow us to better understand where we all are in terms of our own mental wellness and our own health. Just as we have done for almost all conditions, it's actually a constellation of tools and tests that allow us to come to a much more three-dimensional picture of the sort of where we sit in terms of our healthcare. It's going to, I think it's going to significantly advance our understanding as well as our ability to stratify, again, treatment options, because it's not just clinicians. There are many, many other tools that are going to be available as we move forward. Everything from these platform companies to wellness apps to community resources and get-togethers to family events even. So the list it becomes endless in terms of how we start to deal with this.
So it sounds like, Rachel, you're on the right track at the beginning, which is the social determinants of health, because everything all rolls up to there, right? The people you hang out with, the place you're in, the diet you have, the place you can go get food, all of those determinants of where we are. Are you applying that to, let's turn it to hospitals, for example, and those, or are you focused mainly on commercial buildings and offices?
No, like I said at the beginning, well can be applied to virtually any space except for at present single family homes, and we'll have solved for that by the end of this year. So our founder likes to say, if it's got a door and a roof, we can certify it. What we found is that there's actually a tremendous amount of similarity from space type to space type in terms, so long as you craft fairly flexible and open-ended interventions. So for instance, the level of air quality, the levels of CO2, PM 2.5, et cetera, that we recommend for one space type is typically the same that we recommend for another. But we do make small provisions and modifications for distinct space types. Like one of the things I mentioned in one of the responses to Q&A is, we are big champions for an incentivized circadian lighting, which helps to regulate your sleep cycle by exposing you to essentially mimicking the rising and falling of the sun throughout the day. And you've got to be careful, though, about circadian lighting in a place with like shift workers, like a hospital, for instance, or exactly. Like a warehouse. And so we don't necessarily blindly, advise on sort of universal strategies. We're quite careful to think through the differences in space types. Another beautiful example that I love from some of our healthcare projects that was referenced earlier in the session are spaces for employees to really contend with their own grief, trauma, and burnout. And so it's increasingly popular in some of these more wellness-focused healthcare projects to actually have an entire room that's just a place where a doctor or a nurse, for instance, can go to have a good cry when they, lose a patient, for instance. And we've so often forgotten about the health of the people who are caring for those who are ill. And what we know is when you care for the caretaker, that has myriad impacts on the community that they serve. And that applies as much for, those delivering disaster relief to, an affected area as it does to a healthcare provider or a teacher in an urban school district, for instance. So I think it's, it is an opportunity, I think, coming out of the pandemic, but also an imperative, because the Great Resignation is happening across industries. And so, we have to be focused more on these people first strategies and really convey to our employees that we're valuing their own health, that we're valuing them as whole people. And I think, the other place where we're seeing related to healthcare, massive amounts of attrition is in senior living. That's another, kind of opportunity that emerged during the pandemic to really revolutionize an industry, and how we care for not just residents, but also those that are caring for
Looking
them.
after them. Exactly.
Ritesh, could I comment on Rachel's?
You can make two comments if you want.
I so wholly agree with what Rachel just brought up. If you look at hospital structures and healthcare structures, they're actually not that conducive to stress relief and anxiety prevention. There's been studies that show, for example, that 50% of family members who have a child in an intensive care unit suffer from post-traumatic stress disorder. And we need to create the space for within those systems. As an emergency physician, you're often trying to find little corners of a room where you can sit down with family members to explain to them that a family member has suffered from a serious injury or death, and they're just not conducive, neither for the patient or for the care providers. If you go into a nurse's lounge, they're often small, dark, or not dark, usually lit rooms with a table and a microwave in it. And there's not areas where you can go to decompress and relax. And so I think if we could relook at the structure and create the structure that creates the venue for people to have private conversations, to decompress, to have some privacy, that actually just goes a long way in helping facilitate wellness and better mental health.
I think you've nailed it a little bit with respect to the buildings, and you're doing that, Rachel, around that. Lake Nona is one place I've been to recently in Florida, where they've got some really interesting new things that they've put in specifically for this environment. The traditional family room, which was one little sofa and a coffee table, is gone. There's little areas where the children can go hang out and the parents are over here, and there's a private area for the physician to talk to the parents, that sort of thing. So I think you're on the right track here. Let's, we've got about 15 minutes to go. There's some good Q&A coming through. If you have questions, we'll dedicate some of this time to some of your individual questions here. So Marnin, you asked some interesting questions of Professor Huppert around the bad side. I say this to my kids all the time: with every good, there's a bad. On the mental health front and the CBT stuff, focus on numbers, things like that. Is there a downside to some of these things? Have you researched those things?
So everything has a downside, right? Like you just said, I do think that one of the biggest concerns people have that I don't think they need to be concerned about is that technology will replace them, right? And I think that's part of what the question, at least at the end, Martin is saying, and there's no question that the more complex an individual's problem is, the less they'll be able to engage in guided self-help in order to deal with it. And the balance is that we need to make sure that there are many people who can benefit and who don't have access to good mental health care otherwise, and either won't choose it because of stigma or don't even have access. There aren't enough clinicians in the world to treat all of the depression and anxiety that exist.
Exactly.
And so we do need to do something to help scale, both on a prevention level as well as on a treatment level. And then, yes, there are drawbacks. There are drawbacks to everything. There's a classic statement in business that if you don't measure it, you can't change it. And at the same time, Einstein said that not everything measurable is meaningful, and not everything meaningful is measurable.
Measurable, exactly.
Right? So there's both sides to that.
Thank you for that. There's two more. So first of all, Archana, I'm not sure this is a CME kind of thing. So apologies if you're looking for a CME kind of certificate. I don't think this webinar is that, but I'm sure somebody from Nexus Israel who's organized this will tell you. Usha, you had a note around mental health, public policy. So I think we've answered that. So thank you very much. And then Omar, thank you for your statement around Dr. Humberto. Sounds very interesting and in tune with everybody that's on this call. So good observation, we appreciate it. Rachel, there was one more question around some actual examples that we missed earlier that I think you answered already, but maybe we can just remind folks. I think the question was around, can you share 2 or 3 things that you're modeling for clients?
Yeah, at our own organization, I certainly can. I mean, I'll touch on a couple that I mentioned in the Q&A, and then I'll add a couple others as well. First of all, one of our biggest concerns for folks who are working remotely, either through the pandemic or in perpetuity, is that they have a proper ergonomic setup. So we provide funding on an annual basis for people to outfit their physical workspaces. Our head of workplace wellness keeps a digest of all of the products that other staff members love and have purchased, so that people have kind of a reference for some of the standing desks and active furnishings, for instance, that others are recommending from staff. But we also provide any employee that wants it a one-on-one consultation with a certified ergonomist, who then writes up a report and recommendations based on what they've seen of your work from home or work from office scenario. So that covers a little bit on the physical health side. On the mental health side, we've really been trying to think about how we can equip all of our staff, but especially our managers, with the tools that they need to drive improved health and well-being, or even identify acute mental health issues with the staff that they manage.
Yeah, getting the managers trained up to actually sort of, think about it and pinpoint something is more important, perhaps, right?
Maybe. I mean, I spent a week, a couple of weeks ago, not being able to work to my fullest because I pulled my neck out. I think because I was in a subpar working setup. And as the CEO of my company, that's a pretty big loss for everybody. So I think both are important. It's hard to value one over the other, but certainly we know that businesses this year will spend far more money treating mental health related issues and suffering from a loss in productivity related to mental health than they will in treating COVID-19 or any of its related symptoms and impacts. So, we put on a mental health and resilience training for all of our employees by some outside experts, a 5-part series, including mandatory content for managers. And this year, we've offered every one of our employees the opportunity to become certified in mental health first aid. And we've made that mandatory for managers. But I would say that more than anything, the most important thing we've probably done in the pandemic is really focused as a leadership team on making our conversations inclusive. That means taking a different approach to hybrid meetings. That means thinking about how acoustics work when you have people in person and remote. And that also means thinking about how your content is going to translate differently. Tomorrow we have an open forum on Ukraine, just a space to let people voice their feelings, to let people talk about their concerns. 2 days ago, I hosted one on women in the workplace for men and women, coming off of International Women's Month. So, we've also recognized that we have to work harder to create these opportunities for engagement, collaboration, doing team retreats, in person and remotely, for instance. We are missing those organic opportunities to connect with one another.
So one of the things I know my employer does is now they're creating a fund this year for things that you need if you don't have an ergonomic chair, can't afford it,
right,
they'll get you one, right? And it'll be shipped to your house, that sort of thing. Is there some kind of framework that you're creating for employers that you're giving to say, here are the 3 or 4 things you should think about doing this year?
Well, I mean, I think a lot of that more open-ended guidance is found in WELL. So you'll find incentives there, for instance, for organizations that provide something like a workplace wellness stipend or reimbursements for gym or other physical activities. But what we've also realized is there's not a one-size-fits-all to these approaches. And what we advocate for over and over again is health process to first determine what are the needs of the population that you are serving. And there's a lot of good ways to go about answering that. You can look at available public health data. You can do internal, third-party anonymous surveys and so forth. Yeah. But the most important thing is to figure out what ails the people that you are servicing through your organization, and then match strategies to those different risk factors.
Fantastic. In Israel, I know that there's a lot of public-private partnership stuff going on. One of the questions earlier was around how to get things rolled out. What lessons have you learned that you could share with us around what you've done in rolling some of the mental health apps that you've sort of got going out there, Dr.
So for sure, there needs to be a lot of interaction between the user and the developer, which is basic common sense, I think, for all development. And then really getting buy-in from the leaderships of the various organizations that you're working for, and making sure that it trickles down to not just the top of the leadership, but to every level of leadership throughout. Because without support from, in the project that I'm doing, from every clinic's, both head of clinic as well as head of the staff of who are going to be trained, as well as the regions, as well as the national level, then things will start to fall apart. And so it really is really essential to have multiple levels of engagement with the leadership, and also flexibility. I think actually Israelis are known to be very good at adapting and changing at a moment's notice. And I think that that is part of another important aspect of being able to incorporate technology, is to be able to have that technology be adaptable, and probably more adapt the technology to the people than trying to adapt the people to the technology. I think that's also an important aspect.
So, you know, for the startups that may be on this call, or people who are developing things, it sounds like including not just the heads or chairs of departments, but maybe some of the physicians who are actually going to be using these things or providing them to their patients is a best practice that people should be adhering to, by the sound of things. Is that, am I right?
Sure. Yeah.
And the adoption rate is higher, I suspect, because there's some skin in the game there from the physicians themselves, right? I was a part of this. I designed it or helped it along, kind of thing, right?
Yeah.
There's one more question around physical therapy. I think we've answered that actually, which is from Bright, who's worried about the health of remote patients. I think we've answered that one over and over again with lots of conversation. Unless you had something else to add, I think, you know, in general, the home environments need to be looked at, and you're doing a good job of starting to put some strategies and templates around that, right, Rachel?
Absolutely. And there are a ton of free resources as well that can support learnings around proper ergonomics. But what I would really say is, if you're trying to make a case to businesses as to why they should make this investment, you only need to go so far as to investigate the most prevalent health claims in a business. And if you have the ability, you should especially evaluate what it was pre-COVID and during COVID, because what you'll find is that one of the greatest areas of expense to the business, that a business that hasn't properly addressed Ergonomics in their employees' work environments, is going to be musculoskeletal injuries that are highly related to proper ergonomic setups.
Prentice, we're coming up to the last 5 minutes or so. I was wondering around some of the innovations that you're seeing going forward, and I'll ask each of you this. What do you think in this year? You know, I know you're a futurist, Prentice, so you probably thought 10 years ahead of us, but this year, what are the 2 or 3 big things you're seeing around digital health that you're excited about?
Actually, there's a ton of work being done in digital health. Some of it coming out of Israel. For example, Antidote Health has created a virtual HMO that is going to significantly improve access to care, and especially primary care, for a large number of people. I think we'll see tools like that. There's certainly improvements in AI being used in biopharmaceuticals, and being able to vision 3-dimensional inhibitors of proteins and things like that. That's really speeding up the acceleration of pharmaceutical development. And there's a lot of other technologies. MEMAD has come out with a tool that can differentiate between bacterial and viral infections, and that will significantly improve an issue that emergency physicians certainly have in being able to determine the correct etiology of a patient's pathology. I think, so those are just some of the areas that are coming out. I do want to make a couple comments about technology in general. I think technology has an opportunity to significantly augment clinician practice and improve the care that we're all receiving, and to reduce burnout. It's sort of a dirty little secret in medicine that the suicide rate of physicians in trainings now approaches that of veterans. And one of the reasons is estimated because of the rapid increase in knowledge, and that residents in training feel ill-equipped to provide care to the wide variety of patients. There's also accelerated patient care, and the length of stay in hospitals has decreased dramatically over the years. tools that are decision support tools, for example, these types of technologies that help clinicians in their decision-making can significantly augment our decision-making ability, reduce burnout, and we need to actually embrace these types of technologies. And so I think that all these different changes are actually going to allow us to provide a much more in-depth and higher quality level of service as we move forward, Ritesh.
Thank you.
I'm actually a huge optimist of the impact of technologies.
I actually share your optimism. I think the new version of an EHR with all these connected things would be very useful to change the way we deliver care. Rachel, I know you have to go because you've got something to do. So any last words of wisdom for you before you depart? And thank you so much for participating today. Really insightful stuff.
Well, thank you so much for having me. You know, I think we're talking a little bit about optimism and silver linings. So I guess my parting thought to this group is that there are a lot of silver linings that can come out of the pandemic, an elevated awareness around how our physical environments shape our health and well-being, elevated empathy for those around us, for the struggles that they have day to day, and reduced stigma around mental health conversations. And this is only to name a few. But what I will also say is that what history has to tell us is that after the conclusion of a pandemic, there's a fracturing that happens that sort of negates the coming together around the public health and medical communities and other fields like technology and like architecture. And that's an opportunity we can't afford to waste. So I think that's the call to action that I would part with is that we have an opportunity to hold on to that connectivity across industries and practices to really make the world a better, brighter place to live.
Stay together, keep things together as opposed to falling apart once we're ready. Rachel, thank you so much. I know you have to go. So
thank you. Yes, next speaking engagement. So good to be with you.
Thank you. Jonathan and Prentice and I will keep talking for a little bit longer. So Jonathan, any last words of wisdom from you? I know you're doing some incredible work in Israel. What else are you looking at? What other things do you think we should be focusing on?
So I think actually something that maps a bit onto some of Prentice's work is I do think that part of technology and all this AI is also, we're in the age of big data. And part of big data means also taking a different perspective on people, a longitudinal perspective and not just a cross-sectional perspective. And the ability for us to actually really look at data over time and predict what's happening with people and describe what's happening with people is going to be a game changer ultimately. In terms of how we're able to actually determine new treatments and develop new treatments. And I think we have this potential to both translate things that we already know are working into more accessible and more engageable things, and also find new developments that are not just translations of technology, of person to person into technology, but new technologies that will actually be also game changers in different ways. And I think it's really exciting in that way. So I share Prentice's optimism in terms of the future of technology for sure.
Superb. Guys, thank you so much for participating. We're getting the nudge that it is now 1 p.m. here, so we need to stop. Jonathan, Prentice, thank you for your wisdom. Everybody, thank you for attending. Mikhail, sorry we didn't answer your question. Apologies. But thanks, everybody. Have a great afternoon.